Hello guys, today our topic is IV fluid calculation. How we have to do the calculation. This topic is very important for your exam as well as when you are handling with the patient. So you should know how to do the calculation, IV cannulization and how to connect the fluid. Before that, I will explain what are the items needed for this one. Then I will explain the procedure. Then we will go for the calculation part. First, what are the items? Sterile gloves, tourniquet, algal swab, IV cannula, three-way adapter or we can say the connector, gauze, sterile water, syringe, IV fluid, IV set, plaster. These are all the items we needed for this procedure. Then I will tell the each purpose. Before all the procedure, we have to wear the gloves. Why means we have to prevent the infection. Tourniquet, why we are using this one? To visualization of the proper vein. When we are tying this one, you can see the vein very clearly. And cleaning purpose, we are using the algal swab. Then we have to select the proper size of the cannula. If you are taking for the adult, you can take normally 20 cannula or 22 cannula. If you are going for the blood transfusion, you have to take the 18 cannula. If you are going for the pediatric, you have to take 24. Okay. According to the patient condition, according to the fluid, we have to take the cannula. And three-way adapter or connector. After inserting the cannula, we have to connect the adapter. Then, if anything bleeding comes, we have to clean with the gauze. Sterile water and syringe. We have to load the sterile water. We have to flush it in the connector. Why means if anything bulging or redness comes means there is the wrong with the IV cannula insertion. So we have to aware, we have to know what is the normal, what is the abnormal. Then IV fluid, according to the doctor order, we have to take NS, RL, DNS or dextrose, anything according to the doctor order. Then IV set, then plaster. So the IV set also we have to see here they mention 20 drops per ml. So this one very important when you are doing the calculation. So you should know this one. Before opening this cover, just check how much drops they mentioned. Either 15 or 20 or 10 like that. This one is macro set. If we are taking the micro set, that is the 60 drops per ml. So before opening this one, you have to observe how many drops they mentioned. Next, we are moving to the procedure. Here I will not open anything. Just briefly I will explain how to do the cannulization and how to connect the IV fluid. In another class, I will do the demonstration. So first here I will explain what are the procedure, what are the steps are there. First, all the procedure we have to explain to the patient and you get the permission. You have to wear the gloves. After wearing the gloves, you have to take the IV set, connect with the IV fluid and remove the air from this IV set and hang to the IV stand. That is important. So this one you have to keep ready before inserting cannula. Then after that, you have to tie the tourniquet. Then only you can see the correct vein properly. Then clean with algal swab. After cleaning, you have to take the cannula. According to the patient hand, according to the fluid, you have to select the cannula. After opening this cannula, you have to check the needle is good, anything obstruction is there or not. You have to check. So take the cannula. After taking the cannula, you are inserting into the vein. Okay, once inserting into the vein, the blood is coming back. That is the correct position. You are giving the correct IV cannulization. Okay. After that, take the sterile water and take the 10 ml syringe, load it and flush it. Flush into the IV cannula. Once flushing, no bulging, no redness, no pain to the patient. So you are in the correct place. Then connect the adapter or three-way. Then you have to do the plaster. After plaster application, you have to connect the IV set to the cannula. This is the simple procedure. Now we are moving to the calculation part. Before calculation, you should know the formula and important factors. 1 pint, the doctor may write 1 pint, 2 pint, 3 pint. 1 pint means 500 ml. One bottle contain 500 ml of fluid. If doctor is writing 2 pint means 2 bottle. That means 1000 ml. If it is 3 pint means 1500 ml. That you have to know. Macro drops. Through the IV set already I shown over the IV drops we can see how many drops per ml. So according to that we have to take for the calculation. If it is the micro drops, that is the 60 drops per ml. And our formula is flow rate is equal to total volume into drops factor divided by hours into minutes. This is our formula. So before doing the calculation, these three things and formula you should know. So I am giving the example 1. A doctor is prescribed 1000 ml of NS over 8 hours using IV set and the drop factor is 20 drops per ml. Calculate the flow rate in drops per minute. So here they mention drops per ml. So our find out what is that means per minute how many drops has to go. So in that question we have to know how much ml, how many hours it's going and how much drops they are giving, either micro drops or macro drops. That we have to know. Next we are seeing our formula, total volume into drops factor divided by hours into minutes. So here total volume 1000 ml into drops factor, here mentioned 20 drops, divided by hours, here doctor mentioned 8 hours, into minutes. For 1 hour we have the 60 minutes. Okay, so we put 60 here. So 1000 into 20, 2000, 8 into 60, 480. 0, 0 we are cutting here. After doing the calculation, we are getting 41.67. So we are take it as a round figure, 42 drops per minute. Okay, so per minute we have to give 42 drops to the patient. So this is our first example. So why we are taking here 42 means after the digit above the 5 means we make it as a 42. If it is below 5, we are taking as a 41 only. So our next example is, a doctor is prescribed 500 ml of RL over 6 hours using micro drops. Calculate the flow rate in the drops per minute. Here also we have to notice how much ml, how many hours, either micro drips or macro drips. Here they mention micro drips. So micro drips 60. Okay. Calculate the flow rate in the drops per minute. So per minute, how much drops we have to give to the patient. Our formula is total volume drops factor divided by hours into minutes. So here total volume is 500. Drops factor is, here already mentioned micro. So we have to put 60. Hours. How many hours? 6 hours. 6 into our minutes is 1 hour 60 minutes. So 60 minutes. 500 into 60, that is the 30,000. 6 into 60, that is the 360. So our calculation result is 83.33. So our round figure is 83. So after the point, it's below the 5. So we take it as a 83. 83 drops per minute. We have to give patient 83 drops per minute. I hope this calculation is understand for you. If anything you have the doubt, you can message. Thank you.